Good morning. This is Nurse Eunice with Florida Training Academy, and in today's video, we're going to be discussing caring for a patient with breast cancer. This practice test is very near and dear to my heart, and it is the goal is to help CNAs and nursing students not only prepare for their test, but to provide better care for those who have had breast cancer diagnoses. We'll give you a few moments to receive your notifications. And here's some history. October is Breast Cancer Awareness Month, a time to highlight the importance of breast health and early detection. Breast cancer is the most common cancer among women worldwide, accounting for about 1 in 8 women in the US. According to the American Cancer Society, about 297,790 new cases of invasive breast cancer will be diagnosed in women in this year alone, with approximately 43,700 deaths. And good morning. While the survival rate for early stage breast cancer is high, awareness and education on self examinations, regular screenings, and proper patient care are essential. CNAs and nursing students play a crucial role in supporting patients through their breast cancer journey from diagnosis to treatment, including caring for patients undergoing chemotherapy and radiation. Breast cancer is often associated with women. However, it's important to recognize that men can also develop the disease, although with much lower rates. In 2024, it is estimated that around 2,800 men will be diagnosed with breast cancer, and about 530 of those men will die from it. Because breast cancer is in men is relatively rare, it is often diagnosed in a later stage, leading to a higher mortality rate. Awareness, early detection, and education are crucial for men, just as they are for women. Men should pay attention to any changes in their breast tissue, such as lumps, pain, or nipple discharge, and seek medical evaluation if they notice anything unusual. Your role in patient care is crucial. By participating in this practice test today, you're taking an important step in becoming more knowledgeable and confident. Don't forget to like, share, and subscribe to help spread awareness and to support others in their learning journey. And good morning, Latanya. Good morning, Mary. And good morning, Nakisha. All right, so number one, team, what is the primary reason for performing self-breast exam? Is it A, to detect skin changes on the breast? B, to detect lumps or other abnormalities early? C, to measure the breast size? Or D, to check for nipple inversion? We'll give you about 10 seconds to enter your responses in the comment area. All right, and looks like everyone says B. Let's check those responses. You are correct. It is B, to detect lumps and other abnormalities early. So SBEs, or self-breast examinations, help women become familiar with the normal look and feel of their breast and can aid in early detection of any lumps, which can be a sign of breast cancer. All right, question 2. When is the best time to perform a self-breast examination for premenopausal women? Is it A, during menstruation, B, a few days before menstruation, C, a week after menstruation, or D, anytime during the month? All right, I see some answers coming through. I see some C's and I see D's. And the correct response is C, a week after menstruation. So the best time to perform a self-breast examination is about 7 to 10 days after menstruation when the breasts are less tender or swollen. Question 7, what is the most common symptom of breast cancer? Is it breast pain, a lump in the breast or under the arm, a rash on the breast, or changes in nipple color? All right. And good morning, everybody. Happy early morning. So here we go, revealing the answer in 3, 2, and Yes, it is B. You're correct. It is a lump in the breast or under the arm. A painless lump in the breast or underarm is often a first sign of breast cancer, though not all lumps are cancerous, but it's still good to get it checked out. All right, question number two. A patient undergoing radiation therapy is experiencing skin burns. What is the most appropriate intervention by a CNA? Is it A, apply a heat pad to the burn area? B, encourage the use of unscented moisturizers? C, scrub the area gently with soap? Or D, cover the burn with a dry gauze dressing? I had a family member who had a double mastectomy, and she also went through the radiation. And so those burns can be really painful. All right, we're going to give you about 5 more seconds to get your responses in the chat. And we'll reveal the answer in 3, 2, and you are absolutely correct. Yes, it is B. Encourage the use of unscented moisturizers. So patients with radiation burns should use unscented, gentle moisturizers to soothe the skin and avoid irritation. And of course, you would consult with the nurse who would consult with the doctor. They have specialized ointments for those who've had radiation burns as a result of their breast cancer treatments. Question 12. What is a common side effect of chemotherapy? Is it A, weight gain, B, increased hair growth, C, nausea and vomiting, or D, decreased urination? In my first job as a CNA, I worked on the in a hospital on the oncology unit, and that's the unit that takes care of patients, male and female, who have different diagnoses of cancer. And so, just very, very touching. The patients were really, really sick. And a lot of them vomited and had diarrhea. And so, if you chose C, nausea and vomiting, you are absolutely correct. So, nausea and vomiting are the common side effects of chemotherapy due to its impact on rapidly dividing cells in the digestive tract. Right. So, how often should women aged 45 to 54 get a mammogram according to the American Cancer Society? Is it A, every 2 years, A, every year, B, every 2 years, C, every 5 years, or D, only when symptoms arise? I have A's in the chat. Looks like I have a C. And so this one varies based on the actual patient. And so it says here, A, every year, annual mammograms are recommended for women between the ages of 45 and 54 for early detection of breast cancer. But sometimes your doctor will say, hey, you can come every 2 years. But general rule is every year. What should a CNA do if a breast cancer patient undergoing chemotherapy reports extreme fatigue? Is it A, encourage physical activity to reduce fatigue? B, allow the patient to rest and prioritize comfort? C, suggest drinking caffeinated beverages? Or D, call for a blood transfusion immediately? So Mrs. Moore had a double mastectomy, which means that her breast tissues were removed from both of her breasts, which is a long surgery. And she's undergoing chemotherapy. And she tells you that she's so tired today that she doesn't want to take a bath. What do you do? And if you chose B, I'm so proud of you. You want to allow the patient to rest and prioritize care. Fatigue is a common side effect of chemotherapy, and patients should be allowed to rest and conserve energy as needed. You are doing a great job. And yes, Latanya, it just depends on the patient because I've been told every 2 years also, as far as the frequency of getting those mammograms. Which of the following is not a typical symptom of breast cancer? Is it A, new lump in the breast, B, redness or flaky skin on the breast, C, swelling of the whole breast, or D, sudden weight loss? Which is not a typical symptom of breast cancer? Yeah, I'm thinking D too. I'm kind of torn because I don't know this answer. So let's see if my team is correct, revealing the correct response in three, two, and we got it right, team. Sudden weight loss. While weight loss can be a symptom of many cancers, it is not specific to breast cancer. More typical signs include lumps, skin changes, and swelling. What dietary advice is beneficial for patients undergoing chemotherapy? A, eat large, heavy meals to maintain weight. B, stick to high fat, low fiber diet. C, consume small, frequent meals to manage nausea. Or D, avoid all fruit and vegetables. And I know you all are super smart, so this one is relatively easy for you. So we're going to go ahead and reveal the answer because we know that if someone is experiencing nausea, they're going to need to consume small, frequent meals. Okay, so that's going to help them better manage their nausea and maintain adequate nutrition during chemotherapy. Don't forget that the chemotherapy affects the digestive cells, and digestion begins in the mouth. So their food is not going to taste the same. A lot of them are going to lose their appetite in addition to being nauseated. So the care that you provide matters. So be very nice and be very patient because they're going through a life-changing diagnosis. Okay. Which of the following imaging techniques is commonly used to diagnose breast cancer? Is it A, CT scan, B, MRI, C, ultrasound, or D, mammogram? An imaging technique. All right, and we'll reveal the answer shortly. I see Latanya says D, Mary says D, everyone is saying D so far, so let's see if mammogram is correct. And of course it is, because mammograms are the most commonly used imaging technique for early detection of breast cancer, often before symptoms occur. Next one, what is the primary function of the CNA when caring for a patient with a mastectomy? Remember, that's the removal of the breast tissue. Is it A, assist with wound care, B, provide emotional support and encouragement, C, both A and B, D, advise the patient on surgical options? All right, and so we're revealing the answer now. I do see some correct responses in the chat. And if you said C, both A and B, you're absolutely correct because CNAs are crucial in assisting with wound care, post surgery, and offering emotional support to patients who may be experiencing body image changes. You will be there with the nurse, you'll be gathering the supplies, you'll be supporting the patient. Usually, the nurse is going to be doing the actual physical dressing change. However, your support is going to be needed. And don't forget that once a patient has a mastectomy, we usually do not take blood pressures or start IVs or do anything on the arm associated with the breast tissue removal because they usually will also remove the lymph nodes. And so again, we'll sometimes place a sign over the patient's head of the bed that says no blood pressures, no IVs in the left or the right arm, depending on which side the mastectomy occurred on. All right, so which symptom is an early indicator of lymphedema in a breast cancer patient? Is it A, severe pain in the arm, B, swelling in the arm or hand, C, shortness of breath, D, tingling in the fingers? Lymphedema, the root word edema. So that means that the lymph nodes are swollen. What would you expect to see as a symptom? All right, so Latanya gave us the question marks. Mary says A, and so I'm going to reveal the answer in three, two, and it is swelling in the arm and hand. Now, Mary, I've also seen the arm swell too, but usually we try to keep the arm elevated. So lymphedema can occur when lymph nodes are removed or damaged, leading to swelling in the arm on the side of the surgery. So it's just not the arm alone. It could also be the hand too. Which of the following is a common side effect of radiation therapy? Is it hair regrowth, increased energy levels, skin irritation or burns, or enhanced appetite? And because this one is so easy, we're revealing a response in 3, 2, and you are absolutely correct. It is C, skin irritation or burns. Radiation therapy commonly causes skin irritation, burns, or dryness in the treated area. How can a CNA help a patient manage alopecia or hair loss caused by chemotherapy? Is it A, suggest wearing hats, scarves, or wigs? B, tell the patient hair loss is only temporary? C, encourage the patient to avoid washing their hair? Or D, recommend cutting the hair very short? What would be a recommendation that a CNA could make to a patient who's lost their hair due to chemotherapy? All right, and I'm seeing responses in the chat, and we'll reveal the answer in 3, 2, and you are right. It is A, suggest wearing hats, scarves, or wigs. Providing suggestions for managing alopecia can help the patient cope with their hair loss and improve their self-esteem. Some patients will go ahead and cut all of their hair off, or shave it off rather, so that it doesn't fall out in clumps. That could be very distressing. But then once they have come to terms with cutting their hair off, etc., they can wear wigs, and they can also use a scarf. What should a CNA do if a patient undergoing chemotherapy reports mouth sores? Is it A, offer the patient citrus juices to drink? B, provide soft foods and cold beverages? C, advise the patient to use a hard bristle toothbrush? D, suggest rinsing the mouth with alcohol-based mouthwash? It's so much to consider when someone's entire GI tract is irritated, and it's going to be irritated for months. This just isn't something that comes and goes. This is a life-altering diagnosis. And so if you selected B, you are correct. We're going to provide soft foods. And even if you don't want to provide cold beverages, it could be something that is room temperature or something that is comfortable for that patient. Usually we're not going to be giving them hot foods because that is going to further irritate the GI tract. What is a CNA's role in monitoring a patient's intake and output during chemotherapy treatment? Is it A, only measure urine output? B, measure and record all fluids and outputs? C, measure intake but ignore output? Or D, report only abnormal outputs? So intake is what goes in, output is what goes out. So whether that is vomit, urine, feces, if they're having diarrhea, or even if they have a solid stool, we usually like to see a balance. We want to make sure that they're not going to become dehydrated. And that is why the correct response would be B. Yes, we're going to measure and record all fluids, anything that goes in, IV fluids, oral intake. And then we're also going to measure or at least account for everything that comes out. So CNAs are responsible for monitoring and documenting the patient's intake and output to help prevent dehydration and detect kidney or fluid balance issues early. Next one. A patient receiving chemotherapy develops neutropenia, low white blood cell count. What precaution can a CNA take? Excuse me. A, place the patient in a room with another chemotherapy patient. B, use strict infection control measures. C, allow family members to visit freely. Or D, avoid wearing gloves when providing care. So what is the significance of having a low white blood cell count? And you all are so awesome, Nikisha, Latanya, Mary. Great job. You all have chosen the correct responses. The response is B. We need to use strict infection control measures because patients with neutropenia are at a high risk for infection. Strict infection control practices, including hand hygiene and personal protective equipment, are necessary. And if their white counts get really low, we put these patients on reverse isolation. What does that mean? It means that they're not getting giving us the infection, it means that their white blood cell count is so low until they get infections so easily that we're going to wear PPE as the healthcare workers to make sure that we don't bring any outside germs into their clean environment that can make them sicker. Okay, so next, what advice should a CNA give to a patient experiencing nausea from chemotherapy? Is it A, eat large meals to prevent weakness, B, eat small bland meals to avoid strong smells, C, drink coffee to reduce nausea, or D, eat spicy foods to stimulate the appetite? And we've already given you the answer to this one. So you know that if someone's experiencing nausea, that we're going to be doing B. Not only do they need to eat small meals, but it needs to be bland, so they can't have go to the seafood boil and eat all the seafood boil that day. And they need to avoid things that have strong smells. Which of the following is a recommended intervention for a patient with radiation burns? Is it A, apply aloe vera or a prescribed ointment, B, use a heating pad on the area, C, scrub the area with a rough cloth, or D, apply a cold compress directly to the skin? And this test is not just geared for CNAs, it's also a practice test for our future nursing students. And so if giving medications or applying ointments are not within your current role, I still need you to know what will usually happen in regards to this patient care. So if the patient's not able to speak on their own behalf, you as the CNA who's given the bath, who sees this deterioration on their skin, would know that more than likely this person needs prescribed aloe vera or aloe type ointment, or whatever prescribed ointment that the doctor has whatever ointment the doctor has prescribed, excuse me. All right, so here we go. Our next one. What type of breast cancer screening is commonly recommended for women with dense breast tissue? So if you have larger breasts, sometimes the mammogram can't get a clear image of the breast. And so they may ask that you get a different type of test. So is it a 3D mammography? Is it B, ultrasound, C, MRI, or D, PET scan? And this one could be a little bit tricky, especially if you've not either had a mammogram or know of a woman who's had a mammogram. So for this one, it is A, you're absolutely correct. It is a 3D mammography. And so it provides clearer images for women with dense breast tissue, improving detection of abnormalities. Next, a patient is anxious about losing their breast after a mastectomy. How can a CNA support the patient? Is it A, discuss the patient's concerns, B, encourage the patient to focus on survival, not appearance, C, listen to the patient's concerns and offer emotional support, or D, avoid discussing the topic with the patient? All right. And because I know that you are caring and compassionate caregivers, I know that you chose C. You're going to listen to the patient's concerns and offer emotional support because it helps them cope with the body image changes after surgery. Okay. Our next question is, what should a CNA do if a breast cancer patient is having difficulty swallowing due to radiation? Is it A, offer solid foods, B, encourage the patient to eat soft or pureed foods, C, suggest carbonated drinks, D, avoid offering liquids? We're absolutely not going to do D because we don't want them dehydrated. And so we know the best response is going to be B. Yeah, so you all, pureed food still tastes like regular food. I know the appearance doesn't look that good, but yes, we can parade. I was sick one time. I paraded a whole Thanksgiving dinner. And ate it, and it tasted delicious. And so and so if someone can't chew or they can't swallow because of the texture of the food, we have supplements that we can give the patients, but we can also change their diet to a parade diet. The difference is, does the CNA recognize the need to notify the nurse when this person is having issues with swallowing? Okay. So which of the following is a sign that a CNA should report immediately when caring for a patient undergoing chemotherapy? Is it A, mild fatigue, B, slightly elevated temperature, C, bruising or bleeding, or D, hair loss? And revealing the answer in 3, 2, and if you chose C, severe bruising or bleeding, you are aware that they may indicate a low platelet count or thrombocytopenia and should be reported immediately. All right, this person can start bleeding out, and we do not want that to happen. When helping a patient who's receiving chemotherapy, which action can reduce the risk of infection? Is it A, use alcohol-based hand sanitizer only? B, wash hands thoroughly before and after care? C, avoid wearing gloves to make the patient feel comfortable? Or D, only wear gloves when handling medications? And then, as a nurse who may be working on a chemotherapy unit, I do want you to know that those chemotherapy agents are not only caustic to your patients, they're caustic to you. So, anytime you're handling medications, bags, fluids that have chemotherapy agents in them, you need to have on your PPE, because if that gets on your hands, the same issues the patients are having, you can start experiencing. And so, it is going to be B. You're going to wash hands before and after care, because you understand that proper hand washing is crucial to reduce the risk of infection, especially in patients undergoing chemotherapy who have weakened immune systems. And so, yes, proper hand hygiene. And if you are the one who is responsible for hanging those chemotherapy drugs, of course, you go through a certification program, and you're also going to have to use appropriate PPE. Right. A CNA notices redness and swelling in the patient's arm following a mastectomy. What might this indicate? Is it A, infection, B, lymphedema, C, fracture, or D, normal healing? Redness and swelling in the arm after a mastectomy. All right, I see some correct responses coming through. I'm going to reveal the answer in 3, 2, and it is B. We're back to that lymphedema. So, redness and swelling in the arm post mastectomy are common signs of lymphedema, a condition caused by the removal of the lymph nodes. Now, it may not be infection, because they didn't say that it was warm to touch. It didn't say they had an elevated fever. So, remember, sometimes they cut the lymph out. They can remove the lymph nodes. They may even have an incision on their arm. And so that redness could be caused by the surgical incision and the actual surgical process itself, not just infection. What should a fine food should a patient undergoing chemotherapy avoid to reduce the risk of infection? Is it A, well-cooked food, B, fresh fruits and vegetables, C, pasteurized dairy products, D, unpasteurized juices and raw fish? What should they avoid? So what is the difference between pasteurized and unpasteurized? Revealing the answer in 3, 2, and yes, team, it is D. So unpasteurized juices and raw fish should be avoided. When you think of unpasteurized, think of unprocessed. Pretty much just taking the milk directly from the animal and drinking it. So patients with weakened immune systems should avoid raw and unpasteurized foods, which may carry harmful bacteria. A CNA is caring for a patient experiencing fatigue from radiation. Which is the best action to take? Encourage frequent exercise, assist the patient in prioritizing rest periods, suggest caffeinated beverages to boost energy, or allow the patient to remain inactive. Oh, that would be a horrible recommendation from a CNA. We don't ever want them to remain inactive, because if they remain inactive, that means that their blood flow remains inactive also, and they're going to get blood clots in addition to having this major medical diagnosis. So we are going to help them by B, assisting the patient in prioritizing rest periods, because fatigue is a common side effect of radiation therapy, and encouraging rest is important for recovery. However, you getting them up and walking them scheduling that. All right, Mrs. Nancy, I'm going to let you take a nap for another hour. And at 8 o'clock, we're going to get you up and take you for a walk. Okay, just a walk around the unit, and we'll bring you back, because we don't want them in a bed all day. They have to increase their strength and their energy. And plus, walking helps to decrease the chances of pneumonia and also decrease the chances of them getting a blood clot. Okay, so which statement about breast cancer risk factors is true? A, only women over 50 are at risk. B, genetics play no role in breast cancer risk. C, a family history of breast cancer increases risk. D, breast cancer is more common in women with smaller breast. Which factor is true? And I'm so proud of you. We'll be revealing the answer in 3, 2, and if you chose C, you are correct. A family history of breast cancer increases risk. So women with a family history of breast cancer have an increased risk of developing the disease, and those are the patients or the population of people who the doctor recommend that they have their mammograms more frequently. So those definitely would have to have a mammogram at least once a year, once they're at a certain age group. What is the main purpose of administering chemotherapy to breast cancer patients? Is it to cure the breast cancer completely? Or B, shrink tumors before surgery or radiation? C, strengthen the immune system? Or D, improve blood circulation? What is the purpose of chemotherapy? I know this one's a little bit tricky. So revealing the answer in 3, 2, and yes, so it is B, to shrink the tumors before surgery or radiation. So chemotherapy is often used to shrink the tumors before the surgery or radiation, making them easier to remove and treat. A patient undergoing chemotherapy is at risk for dehydration. What should the CNA monitor regularly? Is it A, vital signs only? B, patient's fluid intake and output? C, blood glucose levels? And D, mental status. So this one specifically states dehydration. So the way that you prevent dehydration is by giving them fluids. And so something that you want to be monitoring is going to be B. It is going to be their fluid intake and also their output. Don't forget that chemotherapy causes the patient to be have nausea and vomiting and also diarrhea. So they are going to not want to drink anything, but on top of not wanting to drink anything, they're going to have more output because of the GI distress. And so we need to be monitoring them for their dehydration. And then guess what, team? It appears as if we have reached the end of our slides. And I just want to thank you all so much for waking up with me early in the morning and actually doing this practice test. Do you all have any questions about breast cancer before we exit the live today? And I do appreciate you all again for joining so early in the morning. And if you have a breast cancer survivor, please reach out to them. Just check on them, see how they're doing. A lot of your online retailers have care packages specifically for breast cancer survival patients. So they can get all of their pink items, they can get their mugs, they can get their fuzzy little socks, just something to cheer them up and make their day brighter. All right, and it's because I don't see any questions in the chat. We have 2 lives this evening. We have a live on the differences or between CMA, medical assistant, and CNA, nursing assistant, and which one is best. And then we also have a video that'll be translated into Haitian Creole. That is another practice CNA examination that's just on general care of a patient. And so the first one comes on at 5 p.m. Eastern Standard Time, and the second comes on at 6. And then both me and Mrs. Phyllis will be back on tomorrow doing another live video. So you all have a wonderful day. I'm sending you all kisses and blessings, and I'll see you again tomorrow. All right, bye everybody. You're so welcome, Latanya.